So I can see Garama ma'am and everybody else is like.
Mic open. Okay.
So everybody can hear me, right?
Yes.
Okay. So thank you everyone for inviting me for this on this day. That I've given this chance to make this presentation in front of my beloved teachers and all my dear juniors. So I'm a familiar face with almost all my teachers in here, but I would like to give a small introduction about myself to start with. See my screen, right?
Yes.
Okay. So for this Pharmacist Day, this year's Pharmacist Day, we have selected this, to transform global health and the pharmacist's role in transforming global health. And before I talk about this, let me just tell a few things about myself to those who know me personally. So I'm currently working as a staff pharmacist with Walmart Pharmacy, Texas. So
YouTube. Okay, right after. Okay, like that, it's coming on YouTube. Fine, enjoy.
Everybody can hear me, right?
What I mean?
Everybody can hear me, right?
Yeah,
and see the screen too, right?
I can hear you. We all can hear you.
Okay. So I have a total of 4-year experience with retail pharmacy with Walmart. I started as a pharmacy technician with Walmart in 2016. Clinical and hospital pharmacy practice training with one of the reputed bodies in the state of Texas. And even before that, I have successfully completed the pharmacy internship with GH Hospital as a part of my curriculum. And I did provided my clinical pharmacy services in general medicine, pediatrics, general surgery, then obstetrics and gynecology. And combining all this experience, I would like to highlight my area of specialization at this time. It is providing the best pharmaceutical care services at a community pharmacy setup, where I do extensive immunizations. Then I have a certification in patient-centered diabetes care, so I'm more into treating, looking for patients with diabetes. Plus, since the COVID has started, we are doing a lot of COVID testing too for our patients, and I'm certified to do the COVID testing. Also, I'm involved in doing, it's not my major area of expertise, but I do a lot of sterile compounding, and I'm involved in inpatient pharmacy services as well. So with that being said, I'm gonna just talk in short about the theme that we have selected for this year. I'm not going to take a lot of time of yours. So this year's theme is about pharmacists' role in transforming global health. To understand this theme to its fullest, we need to understand what global health, that particular term, intends when it is put into practice. So I'm gonna just give you a small definition about that particular concept of global health. It is actually the area of research and study and practice that places utmost priority on improving health and achieving equity in health for all people worldwide. So it's just it's a broad concept, but it's when it is tailored down, it just means that the whole people around the world, they need to be considered as equal and provide the best care which they deserve for their particular condition. So with that being said, we know that a lot of countries are currently dealing with the burden of both communicable and non-communicable diseases. The most recent one being the COVID-19, and it's just like any other retractable condition. I'm hoping that in the future we will come up with some solution, like some vaccines or some medications to treat that. But in the meantime, it's going to be a burden. Definitely, it's going to be a burden until that particular point. We do not have anything specific to challenge that. Just like the COVID, like I said, we have both communicable and non-communicable diseases. A lot of stuff's going around, and we being pharmacists, we can do a lot of things which can elevate the patient's burden actually, and provide the best care that they can get for better management of the diseases, basically. So to achieve that, so being pharmacists, we practice in a lot of different settings, and we face a lot of challenges in achieving this particular ideology of global health. I'm gonna just highlight just a few things that I see, that I have noticed over the course of time, like about self-care and self-medication, which is an important thing that we see a lot. Especially, so when I'm talking about this concept, I'm not talking about the things that I see here in the United States. I'm trying to integrate the practices that is happening all around the world. So self-care and self-medication. So people tend to be their own experts in handling medications, which is actually causing a lot of burden when it comes to treatment, as well as the further complication, because when you self-medicate yourself, you can end up with more problems in the future. So it's one of those gray areas that a pharmacist can play a big role, whereby you can give proper counseling and educational strategies, whereby the people become more aware about the proper use of medication as a whole. And we are facing challenges in management of diseases through MTM. So MTM is basically a significant practice where we focus on making sure that patients take their medications properly. Especially this is in the case of maintenance drugs like anti-diabetic drugs, cholesterol medications, blood pressure medications. So these kind of medications, they need to be taken on a continuous basis for the best effect. So MTM is a big challenge that we have. I mean, making sure the patients are taking the medications properly, the adherence is met, the compliance is met. It's a big challenge at this time. Also, resistance to existing drugs. As you all know, most of the antibiotics that were used in the 1970s or 80s cannot be used at this time because of the fact that the microorganisms are developing resistance over the course of time. So it's one of the major areas that we need to focus on, making sure the proper use of drugs. And drugs being abused, it happens with a lot of pain medications, actually. So especially with the narcotic drugs, which are intended to be used for pain, they are being misused for addiction purposes. Then medicine supplied to unregistered online pharmacies. Again, it's a big issue. Even though we have a lot of laws and restrictions in practice, we fail to make sure that these practices are being stopped as such. I feel like the laws needs to be a little more stricter and stringent just to make sure these kind of activities they do not happen wherever it is, like even if it is in India or if it is in the US, anywhere in the world, these kind of activities needs to be stopped. I'll talk about how to stop these stuffs in my own experiences. Then online advertising of prescription drugs. So it's another big issue in most of the developing countries. Like people tend to see those advertisements and they come to the pharmacy just blindly believing those advertisements, thinking about anything else. Like drug interactions or something. And when it comes to the patient's perspective, then direct-to-consumer websites, it's a huge threat at this time, because there are a lot of websites that directly supplies medications to the patients. I mean, I wouldn't say patients, to the consumers, basically, because being a patient, you can easily get access to the medications that are required to treat your condition. But when you go and check out for other websites, that means you purposefully go out and try to get those to get into those kind of illegal practices. And also the distribution of substandard and falsified counterfeit medications, which is, I would say, before 2015 it was a routine practice, but after the amendment of the Indian Pharmacy Act, I'm talking about the condition in India. From what I have learned, from what I have studied, this practice has reduced significantly, but still it is going on in a lot of places, but it has reduced significantly, which is also a big challenge in this present scenario. So with that being said, so these problems are actually causing the pharmacists a lot of challenges in the present scenario. So you need to be more vigilant. So not just be drug dispensers, you need to be more vigilant in what you're practicing. You need to be more aware about the things that are happening around you, especially when talking about all these challenges. A pharmacist, as a professional, because all these challenges, they are about the drug use, and as a pharmacist, you can put your feet ahead of these challenges and make sure we can have strategies to counteract these kind of atrocities that is happening in the whole world. So what exactly this issue does is equal and affordable health care will not be available to most of the people around the world, because these kind of practices either increase the risk of, that's what ultimately is happening. Either it increases the risk of the drugs, or it's going to increase the risk of healthcare, overall healthcare cost. So because, you know, these kind of practices, it eventually leads to more health issues, more health burden, and eventually, you know, in most of the countries, government takes care of the health of the citizens. It puts more burden on the government, and you know, and eventually, the healthcare cost is going to go high. And I'm just talking about the rough, talking in a rough perspective. With that being said, so I believe that the pharmacist, as a professional, we have the potential to address these kind of global issues by providing better health literacy. So when somebody comes to you as being a pharmacy professional, when they ask you about the drugs, for example, if they see something on the television about a drug, and if they come to the pharmacy asking you about the pros and cons of using it, you should be able to educate the patient about the use of this medication as a whole, because there are a lot of things that you need to talk about when it comes to the use of the medication in any individual. So making the patients educated about the medication is something that we can do to improve proper medication use. Then I have found a gray area, which is the management of acute and chronic diseases. This can be correlated with the MTM practices. So when I say about management of any diseases, you need to know the proper treatment plan along with the proper use of medication. How effective is one class of drug in treating a particular condition over the other one. So in this present scenario, we have tons of medications available in order to treat any sort of disease. And still we are struggling to find medications for a lot of other diseases too. I'm not neglecting that fact, but still you need to be in a position to make sure the proper use of medication is happening in treating these kind of situations. Like, for example, to manage in the management of a diabetes patient, we have a lot of options. So we need to be well educated about the proper use of medications for every condition. So personally, when I make my point, I'm already a certified diabetes care specialist. So when a diabetic patient comes to me, I take every stance to make sure the patient is properly vaccinated, they're getting the right medication, the insulin dosing, because over here patients will receive a sliding scale to dose their insulin based on their carbohydrate intake and everything. So we just go through those information from the patient's hand, and it is time consuming, but in the end, it is beneficial for the patient. It is going to reduce their healthcare costs, and if they are compliant and taking those kind of medications like I said, compliance is very important, and MTM plays a major role in making sure patients are compliant in taking the medication. So it's a great area. I don't want to talk a lot about that. Then coming to environmental care, like proper disposal of drugs, it's really important. I mean, you know a lot of stories about the consequences of improper handling of drugs. The story of warfarin. I mean, so it's very important about the proper. Very important that you need to know how to properly dispose of a drug. If you cannot do that by yourself, you need to be in a situation to direct the patients where they can actually dispose the drugs to. And another main area that I would say is like impact. Pharmacists can play a major role in recommending vaccines, which actually prevent the spread of a lot of infectious diseases. A lot of countries require a certain set of vaccinations to be administered to any tourists before they enter that particular country. So as a professional, you need to be knowledgeable about the vaccines that you do. I know I'm not sure if it is actually a practice back in India. Here we administer vaccines too. As pharmacists, we are entitled to administer vaccines. So it's a big area where it can bring a lot of changes, because vaccinations they play a significant role in controlling a lot of diseases in this present world. So we need to step up. We need to common practice still back in India. Over here,